Sorry, apologies from Sarah Deason, Helen Watson, Graham Ebers, Matt Pope, Susan Parsonage, Clive Jones and Charles Margate.
Minutes of the previous meeting. I wasn't actually at the previous meeting, so does everyone else think that they were quite all right? Okay, thank you very much. So I'll sign those later. Right. Have we got anyone with declarations of interest? Okay. No public questions, no members' questions. Before we have the suicide prevention, Tracy was just going to give us a brief outline of the situation now with Strep A. Because I know a lot of people are very worried about it, and I know a lot of doctors are finding they're overwhelmed. So, okay, thank you.
Thank you. Thank you very much. Good afternoon, everybody. Good to see you all. So yeah, by way of update, obviously there has been a lot in the press over the past week or so, and that press interest is still escalating around Strep A and scarlet fever. So Strep A is a fairly common bacteria. In fact, it lives on most of our skin and in most of our throats perfectly harmlessly for all of us, really. It can cause mild illness, but can also escalate. So what we're seeing at the moment is predominantly in children under the age of 10, incidents of scarlet fever. And we're seeing this when we compare the data. This is compared of about 150 cases compared to in previous years to about 800 cases that we're seeing at the moment. Now, the numbers aren't unprecedented. What is unprecedented is the fact that it's happening at this time of year. We usually see scarlet fever, which is a condition caused by Strep A. We usually see it in the spring, so we usually see it around March and April time. So it's the fact that it's happening this time of year that is unusual. Obviously, what's happening in the press is a lot of publicity around children that are becoming very, very poorly, and a number of children who have sadly died. It's in very, very rare cases, Strep A can advance into something called invasive Strep A infection. And that's what happens in this case, which can lead to what appears to be like a sepsis type infection. And it's this that makes people very, very unwell. But I can't stress enough how rare this is. So what we would say is if your children are unwell, presenting with a temperature, scarlet fever also presents, it gives children a very, very red tongue, almost a strawberry red, so a lot brighter than a tongue would normally be. And it presents with like a flushed rash on the cheeks of the face and feels quite abrasive. The way it feels is really, really important because children that have got darker skin, the flushing doesn't necessarily show as clearly. So feeling the rash, it's almost like a sandpaper rash. This means that it is scarlet fever. If you get in touch with your doctor, it clears up after a few days, and antibiotics can be given in cases where that is needed. If children start to get more unwell, become dehydrated, scarlet fever can leave you with a very, very sore throat, which can make it very easy and very difficult to drink and eat. Again, seek medical attention, either by dialing 111 or go onto the websites. All of the councils have got updated information on this now, that you can understand the signs and symptoms and where to go for further help. It's really important you do that. If you think that symptoms are escalating, so children's temperatures are staying high, that they're not able to drink, in very, very small children, if they are having dry nappies, then seek medical attention. Again, this is just as a precaution, but use your own judgment as parents and carers. You know your children best of all, so we would always advise parents to seek support should they need it. But like I say, for the most part, it's a mild illness. It is very, very common and very, very infectious. But for most cases, it is a mild illness. But we are seeing these isolated cases where it has progressed onto invasive Strep A infection. I'm happy to take any questions, but like I say, that I have put some updated information onto the council's website for you to find out more about it and where to go for further advice.
Thank you, Tracy. And it's good just to have that so we can pass it on to those around us, even if we don't have children. So I don't think their question. Sorry,
Hi, Alice.
Alice.
You're on mute, Alice.
Hi everyone. Hi. Sorry, Tracy. I just wanted to find out something else in the sense that we are all concentrating on children alone, but there are also our vulnerable elderly community that can also get this as well. You know, what advice do we give them as well? Because they go down very, very quickly as well.
Yeah, it's the same advice, Alice. It's a good point, well made. You know, you will see this illness equally in adults. It predominantly affects children under 10, but it doesn't mean that adults are immune in any way. So again, it's the same set of symptoms. Obviously, with adults, they're better able to communicate their symptoms than small children. So again, they should be able to articulate their symptoms to 111 or to their GP and get the support they need. But anybody with a temperature who's concerned, who's unable to eat and drink effectively, do dial 111 and get some advice to make sure you're getting the health support that you need at the right time.
Thank you. I think that's everyone. Okay. And sorry, Tracy, but you've got your big one now.
No problem. So thank you for allowing this back on the agenda, Councillor Hare. And just by way of update, we came to Health and Wellbeing Board before the summer after doing a review of the suicide prevention strategy that had been published in October 21. And the reason for that review was that there was a number of changes in policy, and also we'd had updated data sets that had been delayed due to COVID. So we had a different evidence platform to be working from, which hence we took the time to do a review and come to Health Wellbeing Board to get permission to undertake a piece of work to re-establish the Suicide Prevention Partnership and to take a review of this work with a view to put a new updated strategy in place. That work has now been taken, it's been underway since that time. The Suicide Prevention Partnership is now re-established and is working very hard. We've got good multi-agency representation for this, and we have a draft strategy that is now ready for launch of consultation, and that will be launched on the 12th of December at the Suicide Prevention Summit, which is happening this coming Monday online. There are a number of things just to that I think that we're really mindful of as we've moved through this. The changing landscape around suicide prevention and understanding risks of harm and root cause is obviously something that is key to us to help prevent suicide. But also in terms of understanding it from a different population base. So the way it's impacting on very young children through social media and increased harms from that, where children feel quite isolated. And also how we understand the numbers around suicide. We have about 6,000 suicides recorded each year across the country. We know this is likely to be a huge underreporting of actual deaths by suicide in terms of we get a narrative verdict at inquest, for example, or an open verdict. So it's about how we understand the incidence of suicide more broadly, again, to make sure that we can put the prevention in place. Research is showing us that for most people, despair that leads to suicide can happen in very small time spells, as short as 15 minutes. So if we can put diversions in for people that are facing moments of despair just for 15 minutes, we could potentially protect people from suicide. So it's just about how we change the conversation, bring suicide into our wider conversation around health, having health in all policy, but having suicide as part of that conversation, understanding where risk spots are, where suicide can happen, but also how to keep people safe and what are the triggers for that of different transitions in life, for example. So that is where we have got to with this. We have like I say, the consultation will start at the summit on Monday. Dan is on the call as well this evening if people have any detailed questions about the strategy, because Dan has done all the work, bless him. It's a hugely important topic for us. It's a huge public health issue and the one that we want to address. And of course, for those in the room that are hearing this this evening, obviously make sure if talking about suicide, etc. in any way, you go and speak to somebody and get the support you need. But Dan and I are happy to take any questions from the floor or indeed online.
Have we got any questions? Yeah.
I'm slightly confused because the strategy wasn't in the papers.
Yes, so the strategy hasn't been circulated yet. It's being launched at the summit on Monday.
Right. Yeah,
so today is to highlight that the work has been done that we said would be done by this date, and to highlight the summit on Monday.
That was going to be my question. Was this purely just to tell us that you were getting on with it? Yeah, and yes, right. That's fine. Okay, thank you.
Thank you.
Anyone else? I don't think so. Okay, thank you very much, Tracy.
Thank you. Thanks very much.
Just while we're waiting for the slides to come up, just saying my name's Andrew Price. I'm the locality manager for Wokingham within Bob ICB, and I'm also part of the vaccination team across Berkshire West with a particular focus on the data. I'm not going to go through the detail of every slide because they've been in the pack, but I have updated some of the data, so I'll particularly be highlighting that. So the data that I've updated will be as of close of pay on Tuesday night. And yeah, I'll be just highlighting some key points. So that's fine. On to the second slide. So the COVID vaccination programme for the booster in the autumn has focused on key risk groups, either risk by age or risk by clinical condition. We've been delivering vaccinations through a number of sites, and we're going to those in a second in a map version. And just to compare how we're performing in Wokingham compared with the ICB in England, see we're at 72% of the 50+ population, just ahead of the ICB, and quite a clear way ahead of England. So I think overall, I think when we look at the figures, we have done quite well, and we've done better than previous boosters. And I think that's partly or entirely a reflection, I think, of how we've been working this time round. So if we come to the next slide, please. So these sites where vaccinations have been delivered in terms of the fixed sites. Just to note that it is entirely up to PCNs and community pharmacies whether they've been part of the programme. So it's not as if we can do some grand planning and make sure we have the right sites and exactly the right geography. So luckily in Wokingham, all the 6 PCNs have taken part. A couple of pharmacies, we don't really have any big major pharmacy sites in the borough, unfortunately. And then we have the Shoot End site, which Oxford Health run in partnership with the council, with a particular focus on the 5 to 11s. And we also have the Health on the Move van, which again is an Oxford Health delivery model, which the council works with Oxford Health in terms of pinpointing sites where there might be underperforming or particular inequality issues that we wish to target. So if we move on to the next slide, please. this is just an example of some of the places Health on Move van are going, and Sarah O'Connor in the council works with Oxford Health on the sites and the dates that the van visits. We go on to the next slide, please. Just talk about flu. So flu is a far more embedded programme. It's been going for a number of years. Cohorts broadly quite similar to COVID, and they both include sort of the 50 to 65s this year. There's always some debate whether that group is included in programmes or not, because the risk to that group is generally a bit lower than the higher age groups. Delivered through general practice and community pharmacies. We've had about a quarter of the population who've had a COVID vaccination had the flu vaccination at the same time. So that was one of the objectives of this programme this time. Logistically, that can be a bit difficult in terms of vaccine supplies and clinics and things. Yeah, about 26% this time. And I've got some flu data that's a bit old because there's more of a time lag data for some of the flu, and getting comparative data is a bit more difficult. So in Wokingham, the over 65s, we're more like mid 70% now. But just show we're fairly in line with the national and ICB picture on that. Next slide, please. This just shows the structure we've been working within in terms of having oversight of the vaccination programme, and just wish to highlight that the Berkshire West Vaccination Action Group is the key oversight mechanism within Berkshire West, and it's chaired by Susan Parsonage, and there are a range of partner organisations there, including other people from the council. So that's works quite well in getting that sort of multi-agency approach to things. And we also have an inequalities group that again is attended by people from the council as well as Health Watch, etc. So next slide, please. I won't go into this in any detail at all. There's been a lot of work on communications, but I would say, since it started in September, if you mapped out some of the big stories that have been in the news since September, there's, the communication on COVID has been competing against some very, very big stories. And when you see sort of opinion polls and things, COVID has slipped down in terms of people's priorities, particularly at this moment where cost of living, heating, etc. are way there, up there at the top. So we go on to the next slide, please. So these are the slides I take to the vaccine action group once a fortnight. So the green dotted line is the 75% take-up level, and that's sort of a generic target that crosses most vaccination sort of programs. It's not a statutory target, but it's a target that's often worked to. And the black dotted line is the uptake of the previous booster, which will vary from cohort to cohort which booster that was. But here we see, in terms of older people's care homes, Wokingham has performed really well so far. Over 90% take up of the vaccination, and the flu there, there's a bit of a time lag in the data, but I think a very comparable figure in terms of flu as well. So it's been an area of high performance this time around. We move to the next slide. You will see the 75 plus population. Again, we're in the 90% region for this population group. So again, that's really good performance. Should we move on to the next slide, please? Immunosuppressed, which are the folk that have really had the most vaccinations, that had an extra dose as their primary course. So we're just surpassing the 75% mark on that one. We are seeing some continued progress on that one, so we would hope that that's going to improve further, and it is well above what the previous booster was. So move on to the next one. There's no easily available data or locality level for housebound. This is data analysis I do myself in a clinical system. So this is Berkshire West data. We're now approaching 80% of the housebound population who've had a vaccination. And the target for that one was everyone being offered one by the end of November. So we move on to the next one. For women who are currently pregnant, see much lower take up there. I've outlined some of the things that the Royal Berkshire are doing. I had a discussion today with Carolyn Granger, who leads on maternity across Bob this morning. She's going to be attending the next vaccine action group to talk about this further. There are a number of other initiatives that are still taking place that I haven't put up on here. So at the Royal Berks tomorrow, they're doing a video of a pregnant midwife who will then, in that video, explain why she thinks having these both vaccinations, the flu and the COVID, is a beneficial one. There's going to be further training of midwives in how they offer the vaccine as well. And they've had some sort of behavioural sort of insight into that, and some midwives may have been saying, do you want a vaccine, yes or no? And that's quite a closed question. So they're going to have some further training on making that more sort of an open discussion and discussing any issues people may have. And there's going to be a midwife going out on some of the Health on the Move vans as well. And there's going to be some particular targeting of particular areas of deprivation or groups where take up is low. So next slide, please. Health and social care workers. So again, this is an area where performance is lower than previously. So in terms of primary doses, particularly for healthcare workers, we were previously looking at about 90%. So quite a drop there. Social care has always been much further behind, except briefly when the government flirted with that being a compulsory measure. In terms of why that might be, I think certainly the resources available for vaccination staff aren't at the level of that they were during the start of the pandemic. So in the Royal Berks, they would have had clinics going 7 days a week. Now that they're having more like 3 or 4. So the stream of staff going through is slower. There's some evidence of vaccine fatigue as well. But the figure is continuing to rise, even in just in the last few days. So 5 percentage points there roughly. So that's not something we're aware of, but it is, I think, a difficult one to crack quickly. Go on to the next one, please. This just reflects there are clear differences between ethnic groups in terms of the take-up. I would emphasise that if we're actually looking at actual numbers of people, the numbers in some of these ethnic groups in working amongst this sort of more older population are relatively small. But this does reflect the broader picture in terms of vaccination across all age groups, in terms of this variation. I think the one that's quite interesting is the Indian one there, because in Wokingham in previous doses for the wider population, that the Indian population has more or less matched the white British one. So that's quite an interesting, just a bit of a drop there. Possibly might be that some of our efforts have been around concepts or delivery methods which may not be as accessible to some groups than others. So if you look at the makeup of people in care homes, they're likely to proportionally have fewer numbers of, say, particularly Pakistani community where they tend to be cared for within families. So I think some of those sort of things may play into that data. Next slide, please. So this is primary course for 5 to 11s. So take up is relatively low across the board, but given that in Wokingham it's fantastic compared with elsewhere, and I think that probably links into the facility you have here at Shoot End on Sundays where people can come in for a vaccination. Next slide, please. So vaccines are still available. So I checked this morning and there's just in the 2 Wokingham Borough pharmacies, there's 4,000 appointments available between now and the end of December. The numbers here in terms of people who have not had a booster, eligible people not had a booster, that's dropped 4,000 since the figures that went out with the report in the papers. So the numbers are still going through at a reasonable rate. There's also I believe about 500 spare places at the vaccination clinic at Shoot End as well. So there is still vaccine available should people wish to have a vaccination. Overall, Wokingham's at 70% of its eligible population. If we were managed to fill all those vacant slots for Christmas, we'd reach 75%. That covers all the slides. Happy to answer any questions people may have.
Thank you, Angela. So I didn't introduce you. So I haven't got any questions.
It had to be Alice.
Alice, yes. Surprising.
Andrew, don't be like that. Andrew, I'm just trying to figure out in the sense that, you know, you said about the Indian community, not the uptake has not been fantastic. Have we done anything about that? Equally, I know we are doing a lot for the Pakistani and Bangladeshi community, but what are we doing for those communities that are now we're seeing that there's a difference? No, I just think that sometimes we concentrate on one community and not the other kind of thing, you know, so we need to make sure that the messages are out there. Sustainability is what I'm looking at. I'm asking.
In terms of the British, Asian, Indian community, I would say I'm not aware of any specific initiatives that I can think of. As you say, they have targeted some other groups, particularly the Pakistani community, where the take-up is really low. I think generally across the board within NHS or the council, I think the resources available for working on COVID issues are now much less than they have been. But I think some of these messages and this work to be effective needs to be done all the time. And I think that's the tension that we've probably focused our resources on some key areas, but that means perhaps we're not looking at some of the areas which might benefit from some intervention.
Another question, Alice?
No, it's
No.
fine. It's fine. I mean, Ingrid might have the answer.
Ingrid?
Oh, so I've got another question. Sorry.
Oh. But I'm just trying to figure out, Andrew, we need to do something about this because, you know, the ethnic minorities seems to be always on the target, you know, we need to get better. There's something that we are not doing right, that we're not getting them to engage, especially if you turn around and look at the Chinese community, it's really uptake is low. You know, the Indian, now you've identified the Indian community, which is different to the Pakistani and Bangladeshi community. They are ethnic minorities who are disproportionately affected with COVID. We need to make more effort to engage with them. I think what I would suggest is, if that's possible, to go back to the vaccine group and saying we need to do more work on this, please.
Yeah, I mean, it's a sort of standing item on the vaccine age group, so we can certainly raise it again. I think there are a lot of things going on. So Martin White's working with a vaccine specialist of a Muslim background, actually works on vaccines in terms of looking at what's going into them and are those sort of ingredients within the vaccine sort of acceptable. And he's working with that person to do some videos, for example, so that there are lots of things going on, but there will still be gaps. And I think, yes, it'd be useful to reflect on some of those gaps. I think the Indian one is perhaps has taken us a bit by surprise, given that previous performance had been really high.
Mm-hmm.
So perhaps we do need some reflection on that one.
Yeah. Thank you.
Ingrid, sorry.
No, you're fine. Thank you, Chair. Just one question, one comment. I just wanted to comment for the board that a lot of this work from the local authority side is due to Sarah O'Connor and her team, and I'd just like to give my thanks for her unending and ceaseless work over the last 2 years to make the vaccine programme such a success in Wokingham, including at the clinic that we have at Shoot End. To that end, though, I have a question. Given that clinic is commissioned till the end of December, and given that Broad Street Mall has shut, what is the offer to 5 to 11-year-olds and 12 to 17-year-olds from January the 1st? Because PCNs don't deliver to those age groups. So as far as we can work out, there is no provision from the 1st of January, but would be happy to be corrected on that.
I'd have to take that one away. I know there is a level of provision that is being planned for January across Bob, but it is a much reduced level than we have at the moment. How that plays into those young people's age groups, I don't know, but it's a very good question. I'll go away and find out the answer.
Thank you, that'd be helpful. It's from that Bob plan that that gap has been identified. So if we could take that back to Bob, that'd be fabulous. Thank you.
And perhaps that's something that we all need to know as well, so that we can. Sorry, Ruth.
I think you had your hand up before me. Lots of very interesting data. My question was actually going to, why isn't there a slide that shows the 12 to 17-year-olds?
I can do one. I do have them.
Yeah, it's just the missing bit. It feels a bit funny not to have that one in there as well. If that can be circulated afterwards, that would be great. Thank you, Andrew. Sorry to pick it. And I noted also we had an email from Ingrid late this afternoon, just before the meeting, to say we're sort of like top in the country for the 5 to 11s, which is really good to know. Yeah. Yes.
Thanks, David. The number of or the uptake amongst care home staff and social care staff shockingly low, and I wondered whether that's contributing to increased illness amongst workers, and whether that in turn is contributing to shortage of staff and or taking infections into care home and social care settings. And if so, is there anything being done about that?
In terms of the first part of your answer, I don't know if there's any. Ingrid or Debbie could answer that one, because that's a bit more of a clinical question that might answer better than I would.
I think in terms of impact on workforce and illness, it's hard for us to judge that now, given that we're not testing COVID in the way that we were before. So certainly we are having capacity issues as across the health and social care system, contributed to by staff illness, and a degree of that, one must presume, is down to COVID, although it's hard to tell. I think that we have always the social care staff have always had a poorer vaccine offer than the healthcare staff in this area. And I don't know about others, but so I think we have to acknowledge that has been the case all the way through the pandemic and remains the case. Part of our vaccine offer at Shoot End was also for social care staff, but obviously it's not on the premises of their work, which is how it's been offered to healthcare staff. So that's just much easier to fit in to a day's work. So it has been a real struggle. It's not offered to staff at the care home when they're at work, when they do the residents in the care home, for example, which might have captured a whole heap of people. So there's been a lot of discussion, and it really has been unfortunate, I think, that we haven't been able to pick up as many staff as we could have. That said, the data around social care staff is also not as reliable. So the data where Andrew gets that data from is not a source that is fully updated, giving the fullest picture and the most reliable source. So it also needs to be taken with some caution.
Yeah, there may be folk who do work in health or social care that aren't coded as such, so they would have had a vaccination, but will be picked up in the data in terms of the 30 to 40 age cohort, for example. It's worth just thinking that Berkshire Healthcare Foundation Trust have had a bus that have gone out to sites, and they've really brought it close to the staff, and they've struggled with the take up as well. So it's not necessarily just about the access to the vaccine. It might be other things in terms of the communication and the engagement and the understanding might be playing into that as well.
Hi, can I just jump in? It's Debbie. I'm just following up on what Ingrid said. I agree, we're not doing the testing for COVID, so we can't hand on heart say that our health and social care staff are getting COVID. I think the only thing we can say is that there's a lot of viruses out there, and unfortunately all the symptoms are almost identical, whether it's COVID, flu, snotty noses, sinusitis, coughs, chest infections, or even strep A. So I think we are finding people are being hit a lot harder this year with, just common colds and sinusitis and things, which they wouldn't have done in previous years, probably because we've lost some of that herd immunity. And, our frontline staff are exhausted, so they're kind of more likely to become unwell. So I don't think we can blame their illness on lack of uptake of either a flu or COVID vaccinations.
Thank you, Debbie. Any other questions? Sarah.
Thank you, Chair. It's Sarah Webster. I work for the Integrated Care Board for Bob. I'm the Executive Director for Berkshire West. Just to add to that as well, obviously there's been a significant focus on COVID vaccinations for the past 2 years, and in the new year, the intention is to have a bit of a reflective learning through the governance structure that Andrew set out as we move to try and build COVID vaccination into more of a business as usual approach going forwards, as Andrew referred to earlier as well. So some of the points that were raised and questions raised today will be included within that to make sure going forward what's the most appropriate business as usual model for delivering this vaccine alongside flu and any others that we're looking to deliver.
Thank you. Any other questions? I think that's everyone. Okay. So that goes straight into Sarah Webster, who's going to give us something on the ICS.
Thank you very much, Chair. So the next session on the agenda is around the Integrated Care Partnership Strategy. Now, the Integrated Care Partnership is across Berkshire West, Oxfordshire and Buckinghamshire. And the strategy aims to describe what we as a collective integrated system would like to achieve going forwards with all of our collective efforts put together on behalf of the residents that we serve. I will now bring in my colleague Rob, who will introduce himself as well, who's going to talk through the detail of this agenda point and has taken a lead role in coordinating this as it's been co-produced across all of our organisations, along with an awful lot of colleagues from all of our organisations. So I'll start by saying a big thank you to everyone who has been involved in developing this.
Brilliant, thank you, Sarah. Hi everybody, I'm Robert Bowen. I am part of the strategy team employed by the ICB, but I think it's important to say that as we're talking through this, I'm not talking on behalf of the ICB, I'm presenting something that's been developed on behalf of the Integrated Care Partnership. So this is something that is a piece of work that should be representative of all of the different healthcare and local authority organisations across Bob. I also would love to reiterate thanks. There are lots and lots of people that have been involved, particularly Ingrid and Tracy, who have been an integral part of some of the conversations that we've had. So thanks to them, and I'll explain a bit more about what their role has been. We've circulated some slides. What I propose that we do is just, if I quickly talk through some of those slides, I'll do that in two parts. So one part will be looking back over some of the process and where we've got to at the moment. And then the second part, I'd be very keen for us to have a conversation as we look forward into a period of public engagement to understand the Health and Wellbeing Board's views on how we can best engage both residents, but also engage with the Health and Wellbeing Board or other bits of the local authority as we need to. So if people can be thinking about that as we go through some of the process stuff, that would be great. Let me share the slides. Can people see that?
Yes, yeah.
Brilliant. So apologies if people have heard this before. I've been going through similar presentations for a sort of the last 10 days or so. So some of this you may have heard already. I'm trying to start with this slide to set context, and really the important thing here is just to reiterate that what we are presenting here is on behalf of the Integrated Care Partnership, so it is representative of organisations across the whole of the system. If we're understanding this as the ICB or as an NHS strategy, we're misunderstanding the intention of it. So we just need to keep remembering that as we go through it. In terms of what the Integrated Care Strategy is, very simply, it's a document that is meant to be setting a direction for what we want to do together and what are some of the priorities that we want to set collectively for the whole of the Bob area. Its intention is to improve the public's health and well-being, to particularly focus on health inequalities and how we might identify and address some of the health inequalities that we've got across the patch, but also to think about how we can share learning, best practice, ideas for improvement or innovation. And lastly, where we know that there are some big challenges that we face that might benefit from being thought about at scale, how we're trying to think about addressing those. Perhaps more importantly, though, is trying to think about how we're doing this and some of the ways that we're trying to work as a partnership as we do this. So the first one of these is really to think about how this works alongside the existing health and wellbeing strategies that we've got across the three different places. This is not a strategy that is meant to replace or supersede any of those. This is meant to be something that supports and complements the intentions and the ambitions that have already been set in those local areas. So if there is a feeling that anything that we've got here is unraveling what's happening in terms of your locally agreed priorities, then we've probably got something wrong, and we'll need to take that into the feedback as we go along. The other 2 points are similar here about how we have tried, as we've been going through the process to date, to be as inclusive as we can be about the types of people that and representation from different organisations that have been involved in the conversations that we've had so far. And as we look forward over the next month or so, there is a greater opportunity to involve more people. In terms of how we've tried to structure the conversations and identify priorities that we want to take forward as a system, we started by looking at what the different health and wellbeing strategies were and different local organisation strategies were, and that gave us a framework that we have then used to have more detailed conversations. We had 6 thematic areas that were working, 3 of which followed a life course event and 3 of which were sort of cross-cutting through that. Each of these groups, we tried to be as I said, inclusive as possible. So we tried to think about representation from different geographies, from different organisations, from different professional groups, so that we had a broad set of perspectives reflected in those conversations, but bringing the expertise where we needed it. In terms of where we have got to, we have got a draft of what we're calling a strategy, but is basically a set of priorities that have emerged from those discussion groups. But sitting over the top of those 18 priorities, we've got a vision which has been discussed with the Health and Wellbeing Board chairs from the different local authority areas, and then subsequently agreed with a slightly wider group of local authority members and a representative of the ICB that will form the core of the integrated care partnership. And that vision is sort of builds on the thematic areas that we've spoken about. So it's about trying to give everybody the best possible start in life to live the happier, healthier lives for longer, and accessing the care and support that they need when they need it. And so all of the priorities that we've identified will be linking into that vision. But we've got these 5 principles that we see as principles that are cutting through all of those 18 priorities. And those principles are around trying to keep people well, how we identify and address different health inequalities that relate to the different priorities, person-centered in how we are designing and delivering the care and support to people that need it, thinking about how we can be focused on delivering things that are best delivered locally, and supporting the delivery at that local level, and then really only trying to create things at a system level where we need to be doing that, but making sure that we're getting that better join up between services where we need to do that. The slides then ran through the 18 priorities. You'll see that there are actually only 5 thematic areas that we've taken forward. That's because we amalgamated the promoting healthy lives and the protection, the health protection work under one theme. But we've got 18 priorities. I'm not going to sort of read through what each of those 18 are, but happy with support from Tracy and hopefully Ingrid. If people have got questions around what those 18 priorities are, we can talk about where they've come from and why they're important. I'll come back to the bit on engagement in a moment, if that's okay, Chair. I'll pause there for now.
Anyone got any questions at the moment?
Good.
So you're making it very apparent to all of us, or whatever.
Good. I'll jump forward to engagement then. So as I said, we have a draft of this document. We are aiming to publish this into the public domain on Monday, all being well. It may go to Tuesday, but hopefully we're going to do it on Monday. We have agreed this period of engagement because the initial plan that we had identified was not going to provide enough time for us to do this engagement, and it was really important that we do this engagement properly. There's really two parallel parts of this engagement that we want to get right, and I would value your comments and advice about how we think about these two parallel streams. So one is how we engage well with the residents of the Wokingham area, and the other is thinking about which of the different partner organisations that we might specifically want to make sure have got this document when it's published and have got an opportunity to engage with it in a meaningful way. In terms of the public engagement, we will be publishing things online. We have an engagement platform which we are using that will allow people to access the document and a number of supporting documents. It will allow people to complete a survey on what they think about the priorities that are being proposed, and that will provide links to the different health and wellbeing strategies and other supporting information. We've also agreed that we will be working with Healthwatch. We've done quite a lot of work with the VCSE groups, and we'll continue to use those VCSE groups to access as many members of the public as we can. We'll be using existing patient engagement forums, be they the PPG groups or other ones that are existing where we're aware of them. We are linking in where we've been able to with the local authority comms and engagement teams, who we are hoping will be able to support the distribution of this material, and we'll be aiming to have a number of virtual meetings that the public can attend in January. People will also be able to access things that sort of so not everything is online. We'll make it easy for people to get access to the documentation if they need it. And we are trying to work out whether or not it's going to be possible to do any face-to-face meetings that will support the virtual ones, but we're very much hoping that we'll be able to do that in January as well. The period of engagement will run until the end of January, so we've got a good chunk of time. And then following the close of that engagement period, we're hoping to turn around all of the things that we've heard and understood, and ideally publish the document pending ICP approval at the end of February. So I'd love comments and advice about how best we can go about that engagement process, if people have got ideas.
Thank you very much. Can I just ask one thing? Will you have something on the local authority website so people can go from that to the Bob website? Because that's quite important. Otherwise, not many people will go, I don't think, to the Bob website.
So we are trying to distribute the access to this as widely as we can. So yes, we would love to do that. Our comms and engagement colleagues have been in touch with a number of the different, so tried to be in touch with all of the local authority comms and engagement teams. I am not sure that we've actually had contact back from the Wokingham team. So if somebody could help with connection into that team, that would be great. Thank you, Ingrid. Alice?
Thank you.
Alice?
Yeah, thank you, Chair. Rob, thank you for the presentation. I just wanted to ask, I know you're putting it on the online platforms. Are the online platforms easy read? And also, is it ethnically diverse languages? Because that's also most important. It's not, it's fine. We're already going to a stage whereby you're going to have people who are going to be digitally challenged. So we need to somehow make it easier as well, and also the other way is also to suggest maybe a QR code kind of thing. But I do think that that's another way to help engagement. But I do think we need to think about the community, about how to access, because you want their support. So we must make it as easy as possible. And I do think the online platform is going to be very challenging.
Good. So thank you for those comments. Yes, we are developing an easy read version. We were hoping to have that go live on Monday as well. Unfortunately, there's been a delay trying to get that done. So it won't go live on Monday, but we are working to get that done as quickly as we can. So absolutely, we will have an easy read version. In terms of language, we are again trying to make it as easy as possible. And I think there are two things that we're doing. One is, I think, I will need to go away and check, but I think our engagement platform will have the ability to flip between languages on the online version. But then we've also said we can facilitate getting it translated if people have got requests to have it translated into particular languages.
Okay, thank you. Other questions?
Thank you, Chair. Just a question from me. So it's Phil from Involve. Thank you, Rob, for that presentation. That was really helpful. In terms of the VCSE fora that you were talking about, I'm thinking that you're probably referring to the Bob VCSE. That would be the obvious place, I think, in terms of a platform to support the wider distribution of the message around this strategy.
Yes, that's correct. So we've been doing it through the Alliance. Yeah.
That's great. That's awesome. Thank you very much.
Yeah, Phil, I should have said perhaps before, Nick Fellows from Wokingham Volunteer Centre, representing the voluntary sector like Phil. I think we can do something to share the engagement message across the community, within Wokingham in particular, the voluntary community sector, with the partnership board that we have and other contacts. I think it's quite important because our next meeting with the partnership board is not until the end of January, and the engagement closes then officially. So we need to get something out sooner before Christmas. We'll do that.
That would be fantastic. Thank you.
Other questions? Ingrid?
Just a quick ask about whether you're engaging with workforces, because obviously a lot of our workforce, both hospital and health and local authorities, are also residents across the patch. So there's just a synergy there, and actually we can reach those our employees, but also across the whole system might be a way to get things out.
So really good question. At the moment, we don't have anything specific for our workforce groups. We're trying to work out the best way to think about some of our teams that are working in primary care, but in some of our acute hospitals, no, we haven't, and we probably should think about that. So that's helpful, and I think that's an important thing. Just to, in terms of the content of the document that's going to be public, there are some gaps that still will need to be worked up. So that the document is very much focused on the priorities, the things that we want to try and change. What we haven't done is set out exactly how we're going to do that. So there's more material around kind of some of the workforce thinking, some of the joined up data thinking, that will need to be, there will be a little bit that will come through in the final versions, but then more will come out through the different planning that needs to happen off the back of this as well.
Ruth.
Thank you. The one thing I can't see in here is, you say when it will be published, does it start from the new financial year or does it start from the date of publication? And how long does it run for? How long will it be the strategy for before it's refreshed? And then I had a second half to that, which you've started to answer in your previous comment just now, which is that I'm assuming that behind this there will be a whole set of action plans. Who are those being worked up with local authorities or by the NHS and presented to us? So is it a joint? Will that action planning be a joint endeavour as well?
Again, really good questions. Thank you. So in terms of the length of this, so we deliberately haven't said exactly how long it is. The guidance that has given us a little bit of direction about what this document is for and how it should be developed suggests that this is it is something that should be strategic in nature. So it's giving us a direction of travel. It's up for local areas to work out exactly what that is, but it also says that it recognises that different systems are at different stages of development and different stages of trying to think about how the partnerships might work across the system. And so there might be things that we want to change as the system matures, where we articulate how we're going to work differently to deliver some of these priorities. So we haven't said it's going to be for 3 years or 5 years or 10 years. The sort of implicit direction that we've been giving to some of the groups has been that it's going to be for about 5 years, but there is an opportunity to update it faster than that if we think that that's going to be necessary. In terms of the plan, the action planning and the delivery planning, again, that's a really good question, and I think it comes down to some of the nuance about how the integrated care system is going to work in practice. So this is a strategy that's being developed on behalf of the partnership. So there are a number of different organisations that are represented through that partnership. There's things. There are organisations that are sort of part of the NHS family, part of the local authority family, part of the voluntary care, voluntary sector, and others. And each of those organisations or groups of organisations will formally be given the strategy to consider within their own local planning processes. So within the NHS, there is a process where we are coming together to think about actually how do we pull together a joint plan for what we are doing for the next 5 years in terms of the NHS planning. An important part of that process is going to be considering how we are taking account of and going to deliver some of the priorities that have been identified in the strategy. And we would be expecting to do that very much in partnership. And some of that is going to be through the networks that we've got that are existing across the whole of the system. And some of that is going to be much more local about actually how do we think this is going to work at place, and what does the integration and support look like in terms of what we're planning to do at place level. And Sarah might want to say a bit more about what that looks like locally.
Thanks, Rob. So in terms of the specifics, this would be from the 1st of April, really, in terms of when it would come into play, and that was a national requirement. But as Rob said, there's the opportunity to reiterate and refresh. As with any good strategy, you want it to be a live document that you're constantly reviewing. So that's what we would do. What this means for us in Berkshire West, we have some shared partnership governance already across Berkshire West that brings together all of our organisations. So this would then ideally be the strategy that we then hang our local plans off. And looking at the priorities in here, which ones do we think are the most pressing priorities for us in Berkshire West, where we as a partnership can put joint efforts together to really make a difference and switch turn the dial on those areas for our residents. And so that's how the Bob-wide strategy will relate to the work we're doing in Berkshire West. We already have some of that infrastructure in place and have had for a while, because we've been what was previously called an integrated care partnership. Now that terminology has been expanded, so now we're a place partnership. So we've already got some of that infrastructure in place, and we've got had some really good conversations, and are continuing to with Chief Executive, Director of Adult Social Care, Director of Children's Care, Director of Children's Services for the local authorities, voluntary sector, both NHS organisations in the area, coming together over the next few months on regular occasions to say, well, what have we got in place at the moment? How well is that working? And how can we enhance that with a view to being able to deliver against the strategy and the priorities that we want to deliver for our residents? So I think a big test of the Bob strategy, the ICP strategy, is, does it highlight areas where working across the big geography is really beneficial, but does it feel relevant to us here in Wokingham and across Berkshire West as a place as well? So it's kind of with that context in mind that I encourage people to be considering the strategy as well.
I have a follow-up to that, because there's two key words in there. One is integrated and the other one is partnership. And how can I say this politely? There has been a tendency not to be very integrated. But we have managed it locally. For example, with the Better Care Fund, we have done a pretty good integration between the NHS and local authorities, and I hope this is going in that kind of direction. But the partnership part is quite a dodgy thing. It doesn't always feel like a partnership, and sometimes, sorry to say this to our NHS colleagues, but it feels like the NHS is working in isolation. You've got enough of your own partners internally to contend with. I do understand you have complicated structures, different bits, which is fairly opaque to those of us outside, just as local government is probably quite opaque to you. But it's we do need to somehow get over that hurdle and actually work as partners and not as the NHS and the local authority fits into the NHS way of working, which is sometimes how it has felt. And if I don't remember whether I gave this example before, but I was at the National Children's and Adults Social Care Conference in Manchester, and we had, I think it was the director of NHS England, and she was asked a question about why it's so difficult for local authorities to talk to their local NHS representatives, because although they get on with them on a personal level and they work hard, somehow there's always something blocking the cooperation. And the response was, we have a framework for how we talk to local authorities, so I suggest you read it. And that really did not go down terribly well, as you can probably imagine. And that is a symptom of the problem. So I think we are getting more confident. We've got new structures locally, but we're getting more confident in the people that work in them with us locally in Bob. But if you've got NHS England somewhere else, they're a problem for you just as much as they're a problem for us. Sorry, you probably can't possibly comment on that. So I do want to see that partnership. I can anticipate some obstacles being in the way, and some of the bits of the NHS that we have to deal with being less integrated into that partnership than us. But I hope we can make it work, because I do think it's important that we're all working in the same direction. Scarce resources, we need to put them to good use.
Thank you. I appreciate your reflections and your honesty around that. So I'd say locally there's absolutely the commitment and the working relationships to really take this forward as a partnership. That's not to say that there won't be teething problems and things will come up that will test us, and we'll have to work through that together. The NHS element of the plan that Rob just referred to as well is an example where we have an NHS reporting requirement that we will be fulfilling, and we want to do that in partnership, obviously, but the timeframes are tight. But it's being linked back into the strategy that is a partnership agreement. So yes, we absolutely want this to feel like a partnership, and I think the most important thing is that open conversation and communication between us all if it's not feeling like that's how it's going, because we want to hear that and we all want to be able to work on this together. So I appreciate your honesty and openness. I think that's a really good way to go forward together.
Could I just add a little bit to that, Sarah? So I think that's great, and again, thank you for your honesty. I think the most important place where this partnership is working or really needs in its strongest way is going to be at that place level. So actually what is happening in Berkshire West and what are the different relationships? And Sarah probably can't say this as bluntly, but that is kind of one of the key things that Sarah is trying to do. And so I think there's with Sarah in post, there's real opportunity to do that and to do that well in place and to be able to have those honest conversations. When we take things up to system level, there are different challenges that we'll need to try and work through. And that is, I think, where we need the Integrated Care Partnership Committee to be, again, having that sort of honest conversation about how do we plan to work as a system to make sure that we've got genuine partnership intention and genuine partnership working.
Thank you, Nick.
David, yeah. Can I challenge some of the terminology, or one particular word actually? And I appreciate it's probably a national level, but it says on your slides that Bob is made up of 3 places, one of which is Berkshire West. Well, Berkshire West is not a place. And I think there's a real danger. I know it's been raised in this forum before about the concentration on Wokingham particularly, but I think there's a real danger if people get too complacent with the word place to mean very, very different places, and many of them across Reading, West Berkshire and Wokingham, that, you know, the approach could be far too generic. So I just think the terminology is kind of, maybe it's not being done, you know, maliciously, but it's a huge danger that Berkshire West as a place just gets talked about and assumed that one size fits all. And I would really like to see a change in the terminology that reflects much more the local differences across all those areas.
So place is a national terminology for a sub area of the system. So place is that is what Berkshire West is, and the place is an amalgamation of Wokingham, Reading and West Berkshire. However, when we look to how we want to develop our place partnership going forward, it's really important that it chimes with us locally and it feels right. So when it comes to kind of our local branding and how we want to take that forwards, and I think that's a really valid point that we need to take on board.
I think you said this again, Berkshire West is a place, it's not. That's national terminology, and I think there's a real danger of this institutionalised approach to terminology that just doesn't chime at local level.
Thank you.
Stupid question. Where does Milton Keynes fit in? Is Milton Keynes considered part of Buckinghamshire with this, or is it a completely separate thing?
It's part of a different system. So it's the integrated care system that Milton Keynes is part of is Bedford, Luton and Milton Keynes. So they're sort of adjacent to the top of the Bob area.
Thank you. It just occurred to me there's separate local authority in there stuck up the top. Yes, thank you.
Thank you, Prue. In some ways, going on from what Prue said, I was wondering, I mean, this strategy came from the ICP, but where will the strategy eventually, when it's gone through things, where will it be signed off before it's submitted?
I'll defer to Rob for the formalities on that one.
So again, a very good question. There is a requirement that it is signed off by the ICP, so the Integrated Care Partnership as a group, of which Wokingham Borough Council is represented by your leader. So Clive Jones sits as a member of that
No,
partnership.
it's represented by me.
Is it you? Sorry,
Yes.
Apologies. I know that you attended some of the meetings that we've had before, but I thought it was Clive. Apologies. Great. So you have a voice as part of agreeing or not what comes through.
Any other questions? I don't think so. Thank you very much, and I hope we didn't put you through too much grief.
That's good.
Yeah, I think if we can ask real questions and look at real answers, that's his way forward, to have partnership and things like that. So, you know, that's part of what it's about, and it's not always looking at the easy option, but sometimes, yeah. Yes,
well, thank you for the conversation.
Things. Yeah, so thanks very much indeed. Okay, we've now got the Wellbeing Board Forward programme. I mean, looking at the February one, it already looks quite full. Any comments on that? Alice?
Thank you, Chair. I mean, what we would like to do, if that's possible, is have us as Health Watch to come and present to you guys as the way forward, what we are planning to do, if that's possible.
Right. I'm just concerned that GP performance might take quite a long time. Or might not take no time at all because no one can influence it. But okay, the safeguarding was just to be circulated. Madeline said so. Yeah, we can look to influence certainly in there then. That would certainly be good to hear from you and hear a presentation from where you're going and how you're getting on. So that's very positive.
Okay, thank you.
Might dovetail nicely into the GP performance as well.
Yes. Okay. And then the April meeting. Is at the moment quite sparse. Is there anything else they want to?
By then, will we have some indication of how we fared in the winter locally? Yep.
Yeah, that might be, yes, that would be useful. And is it April that NHS dentists change?
We can bring an update on that one in April. Yeah, that's a good timing.
I mean, I know there are a lot of people who want an NHS dentist and can't get one, certainly in Wokingham, and that's something which, yeah, people do resent. But that's up to the dentist much more than us, and that's the problem. Okay. Thank you. Do you want to say something, Alice?
Yeah, yes, Chair. Just to share with you that today there's the Health and Social Committee put out an inquiry about dental inquiry, so we might have something there as well.
Right.
So there'll be something that might come out from that inquiry too.
Okay, thank you. That'd be good. So if we have that in April, then I'm sure we can find other things that might be useful. Okay, has anyone got any other comments? Prue has a comment.
Yes, I do. I don't know where to fit it in, so I'm just going to say it. You can tell us that one. It's not long since we did the pharmaceutical needs assessment thing, which was a thing we can't influence, and we just had to do it. I've had a notification from my GP surgery today that the pharmacy in Sainsbury's in Winnersh is closing in January. And no prior information, indication, anything. They just sent me the surgery's really good now, so they sent me a text saying you'll have to change the pharmacy that's linked on to you and your NHS app. So I've done that, but we didn't know that, did we? Here, it wasn't flagged up as part of the pharmaceutical thing that we looked at not very long ago. And it makes me wonder even more what the point of that was. But I don't know where it leaves us with our actually meeting our needs, because it means now the nearest ones are either in Woodley or in Morrison's in Roos Hill, and nobody in Winnersh can walk to a pharmacy anymore. It'll be a bus journey, and as I say, it's come out of the blue completely.
Yes, and that's quite negative. If no one can walk to it, it's quite a walk. So, Ingrid?
I'll just say we'll take that offline and investigate that, because there's two things to investigate there. One of which is to go to the pharmacy associate committee, but also the other is we should have been notified through a democratic process. So there's two bits to investigate, which public health can take that away and look into that.
Thank you. I mean, it may be that, for example, they're going to open under a different name. I don't know, but that's not the text that I've had for my surgery today. But I would like to compliment the surgery on their communication, because now they do text messages. It's amazing, and they remind me of all sorts of things, which is very helpful.
Thank you, Prue, because that kind of thing it's quite jarring when something like that happens. So, okay, has anyone else got any other business? As I suppose you had. Okay, no, thank you very much, and thank you all very much for coming, whether you've come online or in person. And we meet again in February, the 9th? Yes, February the 9th. So forward to that. Okay, thanks very much.
Merry Christmas.
Thank you, Chair.
Bye.
Thanks, everyone.